Dave Marcon, Marcon Chiropractic and Wellness Center. And today what I want to discuss with you is stretches, very basic stretches that you can do for lower back pain. Now, there are a lot of sources of lower back pain. What I'm going to focus on today though is pain that's coming on either side of the spine going down to approximately the belt line. These are involving muscles that we typically call the paraspinal muscles of both the mid and the lower back region. So I'm going to try to keep them very basic, considering that many of the people are going to have difficulty in this state getting into a lot of stretching positions. So we're going to keep them very, very simple. The first thing we're going to do is discuss what I call is the child's pose. This can be done by kneeling on the floor, and it's going to, again, stretch the muscles that are approximating the lower back on either side, going down to around the belt line. The first thing we're going to do is we're going to get on all fours. Hands out. We're going to extend those arms just a little bit further than our shoulders. Next, we're going to push the hips back. That's going to require the bending at that hip area, but keeping that lower back still in a neutral position. We can further stretch the arms out to whatever our comfort level is. And then we're going to push the head down and allow for that stretching in those muscles. In many cases, the discomfort or the pain or the limitations are on one side more than another. To really hone in on it, let's assume that it's on the left-hand side of the spine. We're going to keep the knees going straight ahead. We're going to pivot our hands and torso 45-degree angles, reaching out, and then pushing the hips back. I always recommend stretches be held for a minimum of 30 seconds. They can be held longer. They should be relatively comfortable, meaning that they're not going to hurt. You're not sweating it out. That it's going to, over the first few seconds, start to relax and become a little bit more pleasurable. At worst, the patients call it a good pain. There's another way to affect the stretch on that area, but not getting on the ground. With lower back pain that can go from the rib cage all the way down into the pelvic area, it's sometimes difficult to get down on the floor to do these stretches. One of the things that we can do is utilize a door frame or anything where we can grab a hold of. So in this position, I'm going to be stretching the left side of my lower and mid back area. We're going to utilize our hand just to hold on to. So we're not gripping, we're just holding. We're going to put the weight onto our heels, slightly pushing our back back, but maintaining a neutral spine. We're not rolling the spine, keeping it neutral, and we're going to slowly let that pull. And in order to affect more of a stretch on the lower back, we're literally going to bend toward the area of tension. Once you feel the stretch, maintain that position for a minimum of 30 seconds. During that time, you might feel like it's loosening up, and you can allow for more of that stretch to occur by putting more weight onto the heels and into the backside. As always, stretches are held minimally 30 seconds. They're done to relatively pain-free. And the last thing is that they're done multiple times a day. The reason being, the more that we can lengthen these muscles and get that body comfortable, we can continue to improve and move. As always, if their symptoms don't relieve themselves in a limited amount of time, seek the advice of your chiropractor, physical therapist, or family physician. Again, Dr. Dave Marcon, Marcon Chiropractic and Wellness Center. And as always, remember, first move better, then you'll feel better, and then you'll live better. Take care of yourself. Bye.